Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, our guest is Chris Beyrer, director of the Johns Hopkins Center for Public Health and Human Rights. He talks to Stephanie Desmond about the crisis in Ukraine and, notably, what could happen to public health and human rights if Russia is successful in its campaign to take control of the country. Let's listen.
Chris Beyrer, thanks so much for joining me.
Thanks, Stephanie. Good to be with you.
So today I want to shift gears from some stuff we normally talk about to talk about the situation in the Ukraine and with Russia. And I know that there are concerns about the public health and human rights history of Vladimir Putin's Russia. And I'm curious, as you watch what's going on over there, what your thoughts are.
Well, I think we're all, of course, very concerned about what is happening in Ukraine to the Ukrainian people. And of course, also now to the over 2 million refugees who fled, about 2.3 million at this point, half of whom are children. So it's really been women and children who are fleeing. Now, there are some special aspects to this, and I would highlight perhaps three. The first is that, as we've seen, the Russian invasion, the Russian campaign has a particular worsening approach about shelling civilian areas, and either deliberately or as a consequence of bombing and shelling in civilian areas, bombing and shelling healthcare facilities, healthcare workers, and patients. So last week, there was an attack on a blood donor center in which a number of blood donors were killed. There have been attacks on an oncology center that was clearly marked as a place where people were getting cancer treatment that was also bombed. And then, of course, just in the last 2 days, bombing and shelling of a maternity hospital in the southern port city of Mariupol, and then also the pediatric center there. You know, this has been a prominent feature of the air campaign that the Russians are waging in Syria, and they have deliberately bombed hospitals, healthcare facilities, and clinics, including maternity clinics in Syria. So the Russians have done this. They have a history of it under Putin. They are doing it in Ukraine, and this is a war crime. It's absolutely a prosecutable war crime. It's also, of course, a violation, really, of all the norms of war. But this is a tool of terror, and the Russians use it. Putin uses it to try and basically subdue civilian populations and have them surrender. That is the goal in Ukraine.
You mentioned there were three things. Can you tell me more?
Sure. So in addition to the attacks on healthcare and healthcare facilities, and of course, this enormous refugee crisis, another really important consideration is that, of course, both Russia and Ukraine and a number of the other surrounding countries where the refugees are going have had severe COVID-19 outbreaks. They were in the middle of an Omicron surge in January and February when the Russians launched this invasion. And what we're very concerned about there is that vaccine coverage rates are low in Ukraine and in the surrounding countries, and there is a high rate of vaccine hesitancy in many of these countries. That is a result of a great deal of misinformation and disinformation, but it's also a direct outcome of the way the Russians handled the development and release of their COVID vaccine, Sputnik V. And this, again, is really an outlier. It's kind of outside the way science is done, which is that Putin was so determined in a purely nationalistic way that Russia was going to be the first to approve a COVID vaccine. And of course, they named that vaccine Sputnik V, which tells you immediately how it's part of a nationalistic project, Russian, if you will, a kind of aggrandizement. But what they did was officially approve that vaccine before they'd done the efficacy trial, right? Well, you just can't do that, right? I mean, you can't approve a vaccine based on immunogenicity data from early phase studies. That's not how vaccine trials work in modern science. But that's how the Russians did it. And that has, from that point onward, put a cloud over that vaccine because we really don't know the efficacy. And the subsequent data, the trials that they said they did and reported on, have been raised by a number of scholars as looking of uncertain validity, potentially cooked. And of course, Russia has a long history of interference in science. So that has added to the vaccine hesitancy in the region. When you put that together, so you have now 2.3 million people, half of them children, many of them ineligible for a vaccine, crowding together, moving in mass ways, crowding on buses, crowding on trains, staying in the subway with thousands of people in the metro, with very low rates of vaccination, and with vaccination with vaccines of uncertain efficacy. You have a situation where COVID-19 it will absolutely be impossible to use non-vaccine measures to contain it. So we're very concerned about that. There were also, Ukraine was under a public health emergency in January because of imported polio cases and polio transmission in children. Those cases appear from a molecular perspective to have been imported from Afghanistan, Pakistan, where polio is circulating. But nevertheless, there were cases underway in Ukraine. And now, of course, people are running out of water and there isn't sufficient hygiene. And a number of the cities are besieged. And of course, polio spreads through oral, fecal, and water routes. So the potential for a Ukrainian and a regional polio outbreak is very real. That's just one example of the many kinds of public health threats that always follow war and invasion, but that have particular relevance in this region.
If God forbid Putin takes over Ukraine, what can the people there expect? I mean, I know that Ukraine has actually been very good with public health. And I wonder if you could talk to me about what the situation was and what we could see if Putin takes over.
You know, one of the reasons why Ukraine was so threatening and perceived by the Russians to be such a problem is, of course, because they have been aligning their laws, policies, and practices with Western Europe. And that goes along with public health. Their public health programs were much more in line with what we would call evidence-based approaches, human rights affirming approaches. A good example is that both countries, Russia and Ukraine, have quite high rates of opiate use. There's a lot of heroin. Of course, Afghanistan is the largest exporter of heroin in the world. And so Central Asia, Russia, Eastern Europe has for decades had serious problems with heroin. Many people who inject drugs and subsequently HIV, viral hepatitis, and tuberculosis rates are very high among young people and in populations who are using. The Ukrainians have followed basically the modern approach, which is evidence-based, which is what WHO recommends, which is harm reduction, needle and syringe exchange, drug treatment, including with methadone, buprenorphine, and other approaches, medically assisted therapies to help people stay off illicit opiates. When Putin annexed Ukraine, Crimea, when he invaded Crimea in 2014, the Russians stopped methadone in Crimea on the first day of the occupation. So that tells you how strongly held these views and beliefs are. They will do that immediately. the Ukrainians will wake up if they are under Russian domination. With the methadone and buprenorphine will end. The policies and approaches that they have been taking toward gay men, gay and bisexual men, which again have been very progressive, evidence-based, that will go away. Russia, of course, passed a strongly discriminatory law. They called it an anti-homosexuality propaganda law, but it essentially makes it illegal to talk about health, public health, HIV prevention for gay and bisexual men. Our project in Moscow, which was funded by the National Institutes of Health, it's a collaboration with Russian NGOs. We were forced to take down our study website, which was informational. It was about where you could get an HIV test, where you could get STI, sexually transmitted infection testing. That was considered homosexual propaganda. They left up hookup apps like Grindr and other ways in which men find each other and find sex partners, and other aspects of gay life. They left those up because the police use those to entrap gay men. So you think you're going to meet another guy, and instead you meet 4 skinheads and get brutally beaten. So this has been a prominent aspect of life in Putin's Russia. They will seek actively to export this and impose it on Ukraine. And quickly. This is not something they will do in 6 months or a year. They will ban methadone immediately.
Why do you think that is?
The Russians have this has been described as an aspect of their identity. They are firmly dug in on their own views. They have a whole professional body of people that are called narcologists. And they vigorously deny and oppose evidence-based approaches. They have their own approaches. They, for example, think they know the site in the brain where opioid addiction is. It's in the temporal lobe. They have been doing modified temporal lobe lobotomies to cut that part of the brain. They think this is evidence-based. They use cold turkey approaches. People basically are arrested. They are chained to beds. They detox in an absolutely brutal way. And we know that cold turkey detox actually is associated with overdose deaths because people aren't treated. Their substance use is not treated. They're just forced into detox. And the first time that they're free, a significant proportion of them will use again, but they've lost tolerance. And so they overdose. So the data on that are decades old, and we know it doesn't work. Nevertheless, they insist on it. And they have the same kind of approaches to a number of other social problems. And this is also a way that they make distinctions between their worldview and their approach and Europe. They're trying to make it abundantly clear that this is a huge difference. I'll give you another example. Every Western European country has laws against domestic abuse. Domestic abuse is a crime. Men are not allowed to beat their wives. Putin, several years ago, very deliberately drove a law through the Duma decriminalizing domestic abuse. It is legal for Russian husbands to beat their wives. And, that is and that was done to support supposedly Russian traditional values. That is absolutely retrogressive. It's an assault against women. It is terrible public policy. It also, of course, leads to the terrible health consequences and psychological, emotional consequences of domestic abuse.
It's all very shocking to me, actually, about how bad it is. And so I guess the big concern right now is is that this could actually happen, that Putin may take over.
They have Putin's regime, and certainly him as the supreme leader, has sought to impose this Russian worldview on all the areas where they seek to reassert authority. So they have already done this, for example, in the 2 regions where they have been at war with Ukraine now for 8 years. the Donbass region, as it's known, on the Russian border in the east. They've done this in the two areas that they occupied in Georgia. The former Soviet Republic of Georgia, Abkhazia, and South Ossetia are those places. They have imposed their views on those parts. There also is a part of Moldova. It's called Transnistria that they are occupying. And many people believe that the country that will most likely be next, if they prevail in Ukraine, will be Moldova. It's a small, poor country nestled between Ukraine and Romania. It's on the Black Sea, but they seek to control that whole Black Sea coast. That is why they took Crimea, which is also a Black Sea port, and why the beautiful old city of Odessa, where I have done trainings and workshops on HIV prevention and on drug policy, on TB, on viral hepatitis, Odessa is so threatened. And the shelling and destruction of Odessa would be really a crime. It's like imagining the shelling and destruction of Venice. It's a beautiful old city. It was actually built by Catherine the Great and her lover, the Russian general Grigory Potemkin, from which we get the word Potemkin villages. And it's a magical place.
Chris Beirer, thank you so much for joining us and sharing your expertise.
Thank you, Stephanie.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.